I'm Phillip Wessinger with Steadman Hawkins Clinic of the Carolinas and the Greenville Hospital System. I'd like to talk to you today about knee osteoarthritis. Knee arthritis is a very common problem. We see it in people who've had previous injuries. We also see it in people who have simply just put enough wear and tear on the joint that they've worn their cartilage out and have caused a problem that is both painful and causes a problem with the ability of doing activities of daily living. There are some very good conservative measures that can be done that can help treat the symptoms of osteoarthritis. And generally, no one thing is the answer to having a more productive lifestyle, improved activities of daily living, and improved pain control. It takes a combination of things. I like to think about these things as 4 different categories. The first category is to unload the joint. The second category is nonsteroidal anti-inflammatories. The third category is improved fitness of the joint to include range of motion and strength. And the fourth category is injectables, or shots that can be given in the knee. The first is probably the most important. Obesity and increased weight and people being overweight puts an extra load on the knee. Simply losing 5 or 10 pounds or more, if that's needed, can be very effective in reducing your pain. Also, under this category of unloading, sometimes the joint wears out more on one side than it does the other, sort of like a tire that's out of alignment. If by looking at the x-rays we can figure out which part of the knee is worn, sometimes we can use braces or even inserts in your shoes or orthotics to unload the side of the joint that is painful. Second category is probably the one that people are most familiar with, which are nonsteroidal anti-inflammatories. These are things like ibuprofen or Aleve, which are over-the-counter anti-inflammatories, or others that are prescription anti-inflammatories, to include Celebrex or Daypro or Naproxen. There's a list of others. These medications can be very effective in decreasing the amount of inflammation in the joint. They do carry some side effects. They can bother people's stomach. Not all people tolerate it very well. They can also contribute to people's hypertension. So there are certain medical problems that need to be followed when we use these medications. The third way, and this is another very important way, is to maintain the fitness of the joint. I've told people that the only thing that hurts worse than an arthritic joint is a stiff, weak arthritic joint. As inflammation builds up in the knee, the joint and the ligaments around the joint tend to tighten, and because the knee is painful, you're not as inclined to use the knee the way you normally would. This allows muscles to become weak. It also allows the ligaments to become tight so that the range of motion of the joint is not good. Doing physical therapy, being involved in a fitness program that does not allow the knee to become inflamed or does not overuse the knee, but yet uses the knee in a way that encourages that range of motion and strength, is a very good way of treating arthritis and treating the pain that you experience. The final way that we can treat the knee conservatively is to use injections. Sort of over the years, we've used primarily corticosteroid injections or a cortisone shot. This does a very good job of calming a knee down and getting the inflammation to go away. However, when used repeatedly over time, can be detrimental to the joint and actually cause some degeneration of the joint. More recently, we have had a series of shots that are called viscose supplementation or hyaluronic acid, which is one of the building blocks of the normal fluid in your knee. These shots have been effective in decreasing pain and lasting for much longer periods of time than corticosteroid, and do not have the same detrimental or bad side effects that we see from cortisone when it's used repeatedly. These shots have been successful. When we look at all of these things, there's usually a combination of 1, 2, 3, or maybe all 4 of these that allow us to be successful in treating osteoarthritis in a conservative manner. Of course, when these different ways and techniques that we use no longer work or no longer allow you to achieve the activities that you need or the pain relief that you need in order to be functional, then surgery may be an option where a knee replacement or a partial knee replacement would be the next step. Thank you.